Welcome to the Medical University of Gdańsk Open Day. In today's program, Introduction, Student Organizations, Interview with the Admissions Office Part 1, Medicine, Interview with the Admissions Office Part 2, Orientation Week, Pharmacy, Erasmus Plus and Alumni, Nursing, what you need to know about studying at the MUG, guided tour through the MUG.
Hello, my name is Tomasz Smiatacz. I'm Vice Rector for Students' Affairs in Medical University of Gdańsk. We are proud to be the first research medical university in Poland. We are also very proud, for instance, of one of our students who received PhD far before graduation, which is exceptional achievement. Perhaps studying in our university is not easy. This is relatively challenging and time-consuming education. We are relatively strict. However, believe me, it's worth studying at Medical University of Gdańsk, and I'm telling you this also as a graduate of this university. Apart from this, Gdańsk is a good place to live, very green one, close to Baltic Sea coast. And this is the place from which it's relatively short distance to many destinations in Europe and all around the world. So welcome you to our open day, unfortunately conducted virtually online this year again. And let's come and see. Let's visit our university. Thank you.
The Medical University of Gdańsk is a modern academic centre, widely acclaimed both nationally and internationally. The university provides world-class education and research. The Medical University of Gdańsk has been acknowledged as the member of an elite group of the best 10 Polish universities awarded in the prestigious Excellence Initiative Research University competition. It holds high position in the annual Perspektywy Educational Foundation ranking. Using the funds provided by the Foundation for Polish Science, as part of the International Research Agendas programme, we established a research and development centre which specialises in exploring acquired genetic aberrations as risk factors for cancer and other diseases. The Faculty of Pharmacy and the Intercollegiate Faculty of Biotechnology, a joint faculty co-hosted by the University of Gdańsk, hold the highest A+ category. Our A category units include the Faculty of Medicine and the Faculty of Health Sciences with the Institute of Maritime and Tropical Medicine. The Medical University of Gdańsk is one of Poland's few universities to be recognized in the academic ranking of world universities, also known as Shanghai ranking, in the clinical medicine category. Our scientists' publications are among the most frequently cited in prestigious journals and help to increase the recognition of Polish science globally. Dedicated and experienced staff and modern infrastructure ensure the highest level of scientific and clinical activity. Clinical teams at the university hospitals are able to conduct both standard and innovative or even unique medical procedures. Our scientists are successful in their research in the fields of, among others, oncology, genetics, testing innovative medication, or using biomaterials which are particularly relevant for developing new, advanced bone implants. They are involved in epidemiological studies, modelling of heart diseases, and paediatric oncology. Some members of our academic community are also the most influential figures in Poland's healthcare system. Their work and achievements are acclaimed and rewarded both at home and abroad. They are laureates of many important awards. and hold high positions in national and international medical associations. The Invasive Medicine Centre and the Non-Invasive Medicine Centre of our university hospital jointly constitute a clinical and research complex, a unique facility on a European scale. The Medical Simulation Centre, equipped with the latest generation Phantoms, operating theatre and virtual reality studio, is where our students improve their practical skills before they start working with patients. The Medical University of Gdańsk runs a number of national and international projects. Transferring knowledge to industry and strengthening cooperation with the socio-economic environment make the university an attractive partner in both research and commercial initiatives. Outstanding scientific staff, major research and infrastructure potential, as well as talented and motivated students all contribute to the current and future successes of the Medical University of Gdańsk. The Medical University of Gdańsk, a world-class university.
IFMSA is the International Federation of Medical Students Association. It involves about 1 million students from 123 countries. It involves medical students, nursing students, paramedics, and other two very important exchange programs, the Professional Clinical Exchange and Research Exchange. Throughout the year, members have the opportunity to participate in different activities that help them garner enough points to qualify for any of the exchange programs. And because IFMSA is active in many countries, members have a variety of choices to pick as a destination for their exchange program.
Here at IFMSA, we have different standing committees. SCOME, the Standing Committee on Medical Education, which aims to create an optimal learning environment by conducting workshops, ECG and switching classes, and Know Your Specialty programs. SCOF, the Standing Committee on Public Health. It covers issues related to public health and conduct the Marrow Hero program, which focus on bone marrow donation and awareness. SCORA, the Standing Committee on Sexual and Reproductive Health and Rights, including HIV and AIDS. They conduct the Pink Lips program, which creates awareness on cervical cancer. DISCORP, the Standing Committee on Human Rights and Peace. They conduct programs like Women's Week and Let's Spanglish.
Here at IFMSA, we offer a peer education program for the students, by the students, where we discuss about the topics that have been neglected during high school, including proper sex education, drug abuse, vaccination, and other public health aspects.
So we understand that first years are not sure about how their anatomy exams are like. So IFMSA organizes anatomy mock exams for them to get an idea of how their exams would look like in real, and moreover they have an opportunity to discuss topics and ask doubts to their seniors.
Here at IFMSA, it's not just academics and research. We also find time to relax and have fun. So what do we do for it? We have an innovative online event called Let's Spanglish to help us with this thought. In Let's Spanglish, we have students of both the English and Polish divisions interacting together once a month, playing online games and undergoing challenges to have fun, enjoy, and take a break from studies.
Thinking of joining IFMSA? It's very easy. Step 1, go onto the website at gdańsk.ifmsa.pl. Step 2, register. And there you have it, you're now a member. You can also join the Facebook group at ED in IFMSA Poland Gdańsk.
We are a group of students who are here to help out other students at Medical University of Gdańsk. This year, our main focus is helping out the freshers, because everything being online, we understand how overwhelming it can get. Apart from that, we have collaboration with amazing student bodies like IFMSA Poland, ANSA, and Phi Delta Epsilon. This year, our main focus is cultural awareness. As a multicultural organization, we just want students from different backgrounds to be more comfortable in expressing their roots. We also aspire to make students more sensitive towards other cultures by spreading awareness and putting focus on our common grounds instead of our differences. And the second one being the integration of English division and Polish division. As some of you might know, we had our first ED and PD integrated mock exam in anatomy, and I think it was a success. It was. We had more than 200 students participating, coming together on one common platform from both the divisions. And we would really want to continue this. Apart from that, we have an amazing mentorship program. You will get more information about that later.
I'm Sheen. I'm the president of our university's chapter of Phi Delta Epsilon. Phi Delta Epsilon is an international medical fraternity, and our motto is Facta non verba, which means deeds, not words. We're a diverse group of medical students united by our passion of giving back to society. We have members from all over the world, including but not limited to countries such as
Poland,
Switzerland,
India,
Canada,
Saudi Arabia,
Norway,
Ireland,
South Africa,
Italia,
United States of America.
We enjoy various social events together, such as learning how to cook from each other's countries. We also exercise together once in a while. We have Christmas dinners and trivia nights, among other fun events.
We have philanthropic events, including charity events such as food drive and clothes drive. We carry out fundraising events, including football tournament and bake sales throughout the year.
We also have educational events for our members. In the past, we have had a phlebotomy course, a first aid workshop, and we have this event called Coffee with a Doctor, where we talk to various doctors from different specialties.
How to join us? Simply follow our Instagram or Facebook and give us a message. We accept new members throughout the year, and in October 2021, we will be hosting a Rush Week. See you then!
Hi, my name is Adam Tuszyński and I work at the MUG's promotion unit. We're here today with Sławomir Wójcik, the head of the university's admissions office, to talk about the programs conducted in English. This will be the first of two presentations covering all topics related to foreign admission. Interestingly, the Medical University of Gdańsk is the most international university in the region. It is largely because the rich offer for foreign candidates. Hi, Sławek.
Hi.
Nice to see you. Thank you for joining us today. Since some of our listeners may be still trying to decide on the direction of their future path, could you tell us a bit about each of the English language programs which we offer here at the Medical University of Gdańsk?
I will be delighted to do that. Medical University of Gdańsk has 4 faculties. 3 of them are running the programs conducted fully in English. At the Faculty of Medicine, we have 6-year MD program. This is the oldest program in our budget. We are running this one for almost 20 years. This is a uniform master degree program offering both a full set of skills and knowledge to become a successful physician.
So this is the oldest program you're running right now. What is this second oldest, if I may ask so?
The second oldest one is the program from the Faculty of the Health Sciences. It's a first cycle Bachelor of Nursing program. We are running successfully this program for 6 years already. 2 years ago, one of our alumni already has been chosen as the best international student in the group of the first cycle. We are very proud of him.
Wow, this is pretty impressive. Thank you. Now, the offer does not end here, am I correct?
Yes, we have also at the Faculty of the Pharmacy 5.5 program Master of Pharmacy. This is our youngest program. However, we are this year we are going to start admission for the 4th time in a row. Our students who are coming from all over the world, last year for the 3 programs which I mentioned already, we have applicants for almost 60 countries all over the world, and the representative of 41 countries has been admitted.
Now this is really impressive. Now, what about the pre-medical course?
The pre-medical course is a little bit different than the 3 previous one. The previous one are the degree programs. That's why you're going to finish this as a medical doctor, the Bachelor of Nursing. In case of the pre-medical, this is a non-degree program which is designed to prepare students, candidates, for the further study. Some candidates, they have some gaps in the education, or they would like to master some subjects before they enter the higher education study. Some of the students are taking after the high school a gap year. A good idea for the gap year to have some kind of rest and also at the same time to stay in touch with the knowledge is to take the pre-medical course.
I understand. Now, although the course lasts only 2 semesters, the curriculum, as I understand, is indeed very rich.
Yes, it is, because we are trying to develop 2 groups of skills. The skills related to the knowledge and also the skills which are later on important during the study. That's why among the subjects of the 1st and the 2nd semester, we have general biology, ecology, inorganic chemistry, physics, but also the subjects which are going to develop a little bit different variety of skills, like basic learning techniques, communication skills. We also do not forget about the languages. That's why the English language course and Polish language course are included in the pre-med.
Thank you. Now this covers the basics and the general offer of the educational programs here at the Medical University of Gdańsk. Now let us review the basics about each of the programs. What is the number of seats in comparison to the 2020 enrollment?
Let me start with the Bachelor of Nursing, because in here the number of the seats is already established. Similar to the last year, we are going to offer 20 places for the students who want to start the study in fall 2021. Also, as compared to the last year, the tuition fee is going to remain at the same level. The cost of the study is going to be 23,000 Polish zlotys per year of the study, per 2 semesters. In addition to this, there is a fee for the orientation week, which is going to also cover the admission fee, and it's going to be 3,000 Polish zlotys. The last year admission gave us almost 4 people per 1 place, and we hope that this year the number of the candidates who are running for those 20 places at the Bachelor in Nursing program is going to be similar.
Okay, so that's Bachelor of Nursing. What about the flagship of the university, the MD program?
The MD program, this one I wanted to spur till the end, because with this one we are not sure about how many places we are going to get this year. The decision about the number of the places for the 6-year MD program is in the hands of the Ministry of the Health. And each year, usually in July, there is a special announcement with the information how many places a given university can offer to the candidates. This year, during the pandemic situation, we may expect a little bit smaller number than the last year. Classes at our university are really small. Small in terms the number of the students who are taking the education in the hybrid mode. That's why there are 5 students per 1 teacher. And that's why this is also one of the reasons why we think that the number of the places this year can be a little bit less than the last year. But we hope that it's going to be around 100 places for our candidates. Last year, the number of the candidates, it was 5 people per place. That's why we expect to see the similar amount of the candidates this year. And let me go directly to the pharmacy and to the Master of Pharmacy program. Over there, the information is already set. We are going to offer similar to the last year, 20 seats. Last year we had 2 candidates per place, but as I mentioned, this is something relatively new at our university, and we hope that this year this program is going to be more popular. I didn't mention the tuition for the 6-year MD program. The good news is that we are going to keep the same amount of the tuition as compared to the previous years. 1 year of the study at the 6-year MD program, it's 44,000 Polish zlotys. Payment for the orientation week is going to be the same, 3,000 Polish zlotys.
Thank you. Now we are left with pre-medical course. Could we head straight into that, please?
Mm-hmm. The pre-medical course is usually program which we are going to run in a little bit different way. We just have to prepare the number of the seats which later on can be transferred into the seats at the 6-year MD program, because graduation of our pre-med is giving the direct access to the 6-year MD program. That's why definitely we are going to wait for the final decision of the Ministry of Health, but we expect to have around 20 places for the pre-med this year, and the price for the study is 33,000 zlotys without additional fee for the orientation week. This is included. What is also important, this fee covers, is usually covering the insurance and the books if the program is conducted in here at our university. And we are hoping that this year it's going to be possible to have it.
Thank you. I understand. Now, you mentioned earlier on the event called Orientation Week. Mm-hmm. What exactly is the Orientation Week? Could you elaborate a little bit more about that?
If you're going to a new place and everything is new, it's also a little bit scary. That's why, based on our experience and discussion with our former students, we develop the way how to make the stress a little bit lower. And our orientation week is partially classes and lectures which are going to introduce what we have to do at the university, where are the classes, what is the form. We are going to familiarize our new students with the teachers, with the tutors, with older colleagues from different student association. And at the same time, we are going to give them time to adjust, to give them time for some games, which are going to create from the more than 100, almost 200 new students, individual students, groups of the students, group of the people, maybe not like a family, but definitely the group of the people who can support each other. Also, during the orientation week, we are organizing the classes of the Polish language course, which are going to help them to survive in the shop, doing things which you have to do on the daily basis. Majority of people in Poland speak English. However, the older generation is not as fluent as the young one. That's why a little bit of Polish language is not going to hurt anyone, is going to be helpful. And also from my perspective, person who visited several countries, if you know the basic words in the language of the country which you are visiting, where you are, it's definitely is breaking some barriers and is bringing you closer to that.
So you're not only building the academic community, but you're also strengthening the bond with the country the students actually visit. They are not only visit, but they are going to live here, right? So
definitely choosing the study. It's a long commitment. It's between 3 years, like in case of Bachelor of Nursing, up to 6 years for MD program. That's why you're going to really learn this country. You're going to meet a lot of people, and I think this is also one of the reasons why you are choosing study abroad, to learn something new, to participate in something new, in something exciting.
Indeed. Now, there's one more thing I would like to ask regarding the orientation week. Now, for obvious reasons, a lot of events right now are taking place online. What about the orientation week? Will it be the same, or maybe you're hoping for the pandemic to slow down so you can do it in a traditional stationary manner?
We are taking into the consideration both situation, and we are going to be prepared for having orientation week either in here at the university or online. Last year, suddenly we had to change our plans and we conducted the orientation week online for many reasons. Pandemic, also not only the problem with the infection, because there is several mechanisms at the Medical University of Gdańsk which are going to protect the students, keep a proper conditions to conduct the classes in the in-person mode. However, that's the beginning of the academic year. Some candidates are going to wait for a visa. Because of this, not necessarily they will be able to be on time. That's why this online possibility to conduct the orientation week is giving them an opportunity to finish all the necessary steps, but also to start at the proper time the academic year. That's why we have some experience from the last year how to organize this in the online mode, and we'll see how it's gonna be. We are prepared for both scenarios.
For scenarios, okay. Thank you very much. Ladies and gentlemen, now let us dive straight into the admission steps for each of the programs. Thank you for your time and your attention. Thank you for watching. Goodbye.
Gdańsk has a very long tradition of teaching medicine. It started in medieval times. On the very other end of the time frame is the present presence of very modern clinical universities. We have Center of Invasive and Non-Invasive Medicine, being a best place for our patients, perfect opportunity for education, and also making science. Third reason would be the fact that the Medical University of Gdańsk is the leading university in Poland. Well, first of all, location. We are very close to the city center. University is also close to the beaches. You just can live your life here. Well, I hope you won't laugh from what the teacher said, but we have sport teams, we have students' organizations like IFMSA, and also we have a bunch of student scientific associations. Well, Gdańsk is a vibrant city. Our airport is trying to be a hub for whole Scandinavia and also beyond to the other European countries. The university is close to the exciting nightlife of city center and also close to the beaches, being a perfect place for a lazy summer day. First of all, I thought the advice would be never be afraid to follow your dreams. But then I talked to the students I had exercises with today, and they told me
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Faisal Al-Maghlouth. I am from Saudi Arabia and I'm a 5th year student at GUMED. My dream has always been to become a doctor, and studying here in GUMED gave me this opportunity, and you will be able to study with people from all over the world. It's the #1 medical university in the country, and it's the only medical research university. And the most important part for me personally is welcome point and Pani Majina. She is absolutely amazing, and she will help you with almost everything, which is a little bit hard to find. The Medical University of Gdańsk gives you a lot of opportunity to participate in extracurricular activities. They have a lot of circles, scientific circles, which help you with increase or improve your clinical skills, your research skills, and help around with not only school-related activities, but also with the community. I am also a member of Phi Delta Epsilon Theta chapter. It's an international medical fraternity based in the United States. Highly recommend. It helps you with improving your clinical skills, contributing to the community and society, and also improve your leadership skills. And it's the most inclusive. So, Phi DE. Woo woo. The history of the country is amazing and so rich, and specifically this city, Gdańsk. The location on the Baltic Sea, beautiful, beautiful place to go during the summer especially. And the architecture of this city and the old town. It's a really nice place to go, even if just for a walk. Studying medicine is difficult, it's hard, but follow your dreams and go to GUMED.
Hi, my name is Juliana Orrego Castellanos. I am from Miami, Florida. I'm a 5th year medical student from English division at the Medical University of Gdańsk. The biggest reason for me was that after you graduate, your diploma is acceptable internationally, so that was a very important reason. Also, you get to live in the beautiful seaside city of Gdańsk, and our new hospital is so beautiful, it makes you feel like you're in an episode of Grey's Anatomy. GUMED gives you an opportunity to work on your soft skills. You quickly become more responsible, you learn to communicate with authorities, you learn to take care of your own matters, and all of this gives you an opportunity to work on your communication skills. Also, the diversity. Here you study with people from all over the world. And you make international friendships that in turn become future connections. There are many student scientific circles and also international student organizations, so you can get involved either with improving your clinical skills, but also you can contribute to your community. And if you're really interested in a particular field, there's always a good number of doctors that are willing to take you under their wing and become your mentors. Gdańsk is such a special place. There are things to do all time of the year. The town is filled with so much history and charm, but then you can also find yourself in the very modern part of the new city center. Also, the gastronomy in the city is amazing. You have, your typical Polish cuisine to American to Indian and also Thai. I think it's very important for future students to get in touch with current students, get their opinion on the matter. Try to visit the city if you can, see, the city around, get to know the school. Also be prepared to study very hard and have a good support system, because medical school will be a little bit difficult.
Hello everyone, thank you for joining us today at our university, Medical University of Gdańsk, for Open Day. And here I'm going to introduce you guys to our 3D printing lab. I'm a medical student, 6th year medical student, who has been involved in 3D printing for the past couple of years. And I've had the great opportunity to learn about 3D printing, all its capabilities, as well as its amazing ability to both create something new and develop something just completely out of your own mind. We've been using the process to try to learn more about heart anatomy, but the applications range from basically everyday utility where you want to build something that you've broken at home, all the way to building hearts and models for prosthesis, as well as for designing and better understanding the anatomy of the human body. So the process itself is kind of very complicated, or not too complicated. If you understand how a printer works, it's more or less the same idea. We have a couple of machines here that I can show you, and each one has its own design process. So what we have here, just to make life a little less complicated, is essentially a printer. And we have a print base that we'll show you a bit later. And on that, we have a printing head, just the same as a normal printer. And what ends up happening is material will be extruded from that print head and will be fed through that print head, just like ink from an inkjet printer. There we go. And as it gets heated, this material melts a little bit. And once it gets extruded from the print head, this material melts and deposits on the print base, which is over here. An example of that, print base is just like this one. And we have a partially completed print over here. And so material gets deposited layer by layer on here. And as a print head goes down, it deposits a little bit more and a little bit more of each layer. And hopefully, eventually, assuming that the print completes and doesn't fail at any point, we will eventually have something like this. So using this material right here, we send a set of instructions to the machine that eventually prints out something as cool as that. So this is an example of one of the hearts we printed out, and I'll show you different other examples of that as we move forward. So this is one example of how the printing machines work. However, this isn't the only way we have to actually print our models. There's another method which actually uses one of these orange-looking machines, one of this one or this one. What ends up happening is we have a liquid layer at the bottom, and we have our tray that prints, or rather the print bed, is actually inverted. And so what ends up happening is we dip the tray bed into the liquid, and we have some UV lights that cures the material onto the print bed. And what we can do is actually cure something that can be transparent, so something like this. So as the print bed rises, we have material that gets deposited on the print bed, and it essentially kind of appears out of the liquid and out of the ether. And as we raise the print bed, we then raise the, the z-axis, and we end up printing more and more material as we cure it and as we raise the layer. Now we have more sophisticated machines. So one of the things that we can also do is print in two different materials. So this is, as you can see, kind of like a soft material and very pliable. And over here we have a much harder material that's a little bit more resilient. And so there are lots of different types of materials you can print with. Some that are, like I said, flexible, some that are transparent, any color you want, multicolored. So your imagination is kind of the stopping point. On here we actually have two print heads. So you have two materials in here, and what ends up happening is one is a support material. So as a result of the complex nature of the structure, sometimes the print can fail. And what's important is that these supports be there so that as you print, you have something to print off of. And sometimes it can be a bit tedious to try to clean something like this up. So what we do is we have a print material that we want the actual end result print to be, and we have a material that can be dissolved. So one of the print heads prints with the dissolvable material, which is all these supports, and the other is the actual material we want to end up with. And so what ends up happening is we take that design and we end up putting in kind of like a sonic bath, which ends up melting the material and dissolving it. And all we're left with is the end product. For example, something like this, without all the supports. And that's a little bit about the design process and the actual way these machines work. There's a lot that goes into creating the machines, creating the designs, and depending on what you need to get done, we both create the design process as well as take hearts from patients and then take the DICOMs, which are kind of the picture files, and use those picture files to create our 3D model. With that 3D model, we then clean it up a bit because it's never really perfect when we export it from the DICOM. And that cleaning process is an artistic process, let's say, where we have a kind of a 3D model on our computer and we clean it up by removing the parts we don't need and keeping the parts that we do want. So it's a little bit of artistic design that goes into that process. Once we have that completed model, we then export that into another program which divides the model into different layers, which is a kind of a process that the printers will then understand how to print. So each of these layers are traced out by the code of the printing software, and as a result of that tells the machine how to layer and place down material, and we end up with something like this, something very complex, but something the machines can understand. So I think that's a little bit enough right now about the initial introduction about 3D printing, and we can introduce Dr. Share, who will talk to you about how this initiative came about at the Medical University of Gdańsk.
I am Jarosław Meyer-Szary. This is our 3D printing lab in Medical University of Gdańsk in Pediatric Cardiology department. We've started more than 4 years ago, and we started very simple. This was our first printer that we had, and it was standing just at the doctor's desk, just next to the usual printer that we use on everyday basis to print patient files. So this is how we started. We printed models that really amazed us and opened our eyes how this new technology can help both the doctors and the students to better understand anatomy of complex congenital heart diseases. So most of the models that we've printed, and it was more than 70 I think now, are upstairs at the department, but this is a copy of the very first model that we did. It's a 3-year-old boy with coarctation of the aorta. This is narrowing. That was the problem of this boy, and this was the very first model that we've done. Later on, we've done many different experiments on this technique and what it can help and what it can do. So we tried models made up of 2 different anatomical parts, like the cardiovascular system printed in white here, and the trachea printed in a different color, to show how the congenital heart disease of the great vessels affects the trachea, how it compresses it. It's a case of a vascular ring that needed surgery. So this model was also used to plan surgery. This is another model. The diagnosis was made prenatally as the baby was born. MRI and CT were done. So we not only use different colors, but we use different modalities in some cases, like CT and MRI, to make the best model possible. So cardiovascular system is best shown by CT, and it's printed in red here. And the tumor that was obstructing the vessels was printed in white, and it was scanned in MRI to best show the tumor, because in CT it wasn't so much visible. And soon after the model was made, the baby, still being a neonate, needed surgery, and the model was also useful to guide the procedure. We sometimes print 2 models for one patient, like in this case, and this is a heart of an adult. Therefore, the heart is way bigger. We always print 1:1 scale to show the sizes, the actual dimensions of the heart and of the model. So first, this is what we call an anatomical model of the whole heart and vessels. Another tumor. This was an old hemorrhage, and there is an aneurysm here that is surrounded by the hemorrhage, and the model was done to plan surgery again or interventional treatment, and finally it was done interventionally because surgical approach due to the tumor would be way too risky. So to better plan the intervention, we then made another model that is empty inside. So this is only this part, the upper part, the area where the aneurysm is. And it was possible to introduce the devices, the catheters, from this side and from this side to decide from which approach the intervention would be done best. So the doctor that was doing the intervention could earlier kind of train the intervention on the model, and therefore the final intervention was done without any hesitation in a very short time, and with a successful closure of this aneurysm that we can see here, preventing further expansion and bursting of it. So this is a different model done in a semi-transparent material that shows you one of the devices that are used in our department to treat congenital heart diseases, and this is how the device is sitting inside the heart. And you can also simulate the process of closure of treatment by inserting the device into the model in a way similar to how it's done during the procedure. So this is to close the defect in between the two atria. Obviously this is not done by bare hands, but this is only to demonstrate how the process works. We use these models, like I said, to plan our treatments, to plan surgeries, to plan interventional procedures, but we also use those models later on to show off students how we do it and how complex different congenital heart diseases can be. Because even one congenital heart disease can have multiple varieties of anatomy, and it's very difficult to fully appreciate this variability just by words, by descriptions, or drawing schematics on the drawing board. So only by printing models of each patient and then comparing patients having seemingly the same congenital heart disease, but oftentimes very different anatomy, we can fully understand to which extent the cardiac surgeon has to prepare for its surgery and has to adapt surgical strategies during the operation, and why they take so long and why they are so risky. So this is another example of a neonatal heart. This is how small they are. And another example, they just barely take place in your hand. You can hide them in your fist. So this is how small they are. Students, I must say I was amazed how much appreciation and how much positive response we got from students after showing them the models, after doing 3D printed model-based education of congenital heart diseases. They literally all agreed that this is great help to understand the anatomy, to better understand congenital heart diseases, to understand the surgical procedures or interventional procedures. They agreed that this should be used in different departments to learn also other diseases and anatomy details of other regions. So as we can see, this has great potential for medical education, not only for surgical planning, and we're working hard to introduce it to other fields of medicine now. we're waiting for you in Medical University of Gdańsk. During the pandemic, the print lab was repurposed totally, and we had less patients, but totally different problems. In the early days, there was a lack of personal protective materials like simple face masks or the face shields. So students, led by Marlon, came up with an initiative to print those very much wanted and very necessary personal protective materials like the face shields and face masks. And it was a great success. It was a very big help in the early days. So I'll ask Marlon to talk more about the details of this process.
My name is Marlon Sosluos, and I was one of the students who were involved in trying to help along with the pandemic. And at the beginning of the pandemic, I know everyone hopefully remembers, everyone was quite scared about the whole idea of the coronavirus, and no one knew exactly how to protect themselves. We were very short on equipment. The hospital didn't have enough equipment. You know, healthcare providers didn't have what they needed to protect themselves or their patients. So what we decided to do was try to use the 3D printing process and the skills we learned from modeling these hearts to try to create PPEs, or personal protective equipment. And the nice thing about 3D printing is that it's a very modular process. It's very easy to iterate. And so what we initially did was something with a very simple design, which is basically you, and we ended up gluing a basic plastic sheet around this, which looked something like that, and that was our first step in designing process. So it was very simple to make, very easy to design, and what we decided to do was, it wasn't perfect. So what we ended up doing is, over the next few weeks, now this entire process, I think at the peak of the time of the pandemic, took about 4 months, but our design process was very quick. So going from something like this, we used the help of the internet. So lots of people at the time, we weren't the only ones doing this process, had their own ideas and their own concepts of how to build and create models or protective gear. So we designed and, we took those models and we printed it out to see which suited our problem best. And so we were able to create take the different designs that people created on the internet, change them a little bit to see how it suited our needs, and combine all the best features of each of those. And so as a result of combining all of those processes together, we were able to find something that all the doctors, or most of the doctors, agreed was the best design for them. And it ended up being just something simple like a pair of glasses that had a modular design in such a way that you could always replace the face shields as they would get worn out, and they were comfortable enough to wear constantly without having the tension of the headband. So as a result of the iterative process, we were able to design something like that for face shields. We also did something for the patients, or for people who required a more constant use of the face mask, because we didn't know that the simple face mask would be enough. At the time, we wanted something more protective, and the initial thing was something similar to this, but it was kind of a little bit complex and it wasn't perfect. So we ended up designing something like this. It looked kind of funny at this point, but we were able to put a filter paper on top of this, and essentially you'd wear it kind of like a mask. It wasn't perfect, but it worked perfectly at the time, and thank God we can use these now. These were a little warm and a little uncomfortable at the time, but it suited the purposes that we needed, and we were able to design custom ones per the patient, especially for pediatric patients. We didn't know how it affected younger, more critical patients, so we ended up making designs that changed the profile of the mask in such a way that it would contour to the face of the patient. So each of them were designed specifically per patient. And luckily right now we aren't in need of something so complex, but at the time it was very useful. So thanks to the very quick iterative process that we're able to design, prototype, and create all these different models in a very short period of time, we were then able to use all these machines to basically create a farm of manufacturing processes. And luckily, eventually, Prusa came up with a very innovative design that everyone loved. So we then adopted their models and started printing their design. And with this, these are actually 4 different prints which are printed on top of each other, and they can easily be cracked and split apart. And essentially they kind of split apart, and these are just 4 face shields. So right now we don't have a need for any of this, but in the future, if there's any problem that we needed to solve, we were able to solve it. One of them being the ventilators. We were short on ventilators, so what we decided to do was split the flow for each one so each ventilator could be used for multiple patients. So we had designs that we ended up using for that. We also had problems with some of the earpieces that were required to measure temperature. So we designed models that would actually put sleeves onto the earpieces. So we ended up making stuff like that. So we also ended up making a makeshift ventilator. So the ventilator itself isn't perfect. We were just testing it out to see how good it was. And at the time we were very short on ventilators. So this thing works. It's a little bit scary at first. It's very loud and it's not perfect, but we were trying to see what we could do at that time. Now we know more, and we've learned a lot from this entire process. And thanks to the skills that we gained at that time, we're able to better ourselves with our knowledge of how to model things, how to go through the design process. And that's actually translated into better models for the patients and for our heart models. So there's a lot of great lessons that we learned at the time due to an unfortunate circumstances, but thankfully it was a good learning experience for ours. So hopefully you don't have to go through something like that, but maybe sometime in the future you'll be able to design and create your own models that you'll be able to create for yourselves. It's an amazing feeling to make something as kind of like a model on your computer and then have it print and then have it work. I'm not sure that some people have had that feeling in the past when you've used other material, but this is something a little bit different, and I hope that you'll be able to enjoy the experience yourself. Thank you.
Hi, my name is Sean, and I'm a medical student right here at the Medical University of Gdańsk, and I'm here today in my dorm room, and I have the pleasure and opportunity to talk to you about some research opportunities here at the university. I personally am interested in neurology, neurosurgery, and psychiatry, so most of my research has gone into these fields, but the opportunities are wide open in any sort of topic that you choose. Why was I chosen? Well, I'm not sure, but I do have some experience in research. I have more than 30 publications in the last 2 years, and I have about 100 citations. So, well, come with me on this presentation and I'll show you a little bit about what's going on here. Alright, so let's start and talk about the research at the university. So you already know a little bit about me. I'm interested in the neurological sciences, really anything about the brain, and yeah, I just really enjoy medicine and conducting research in this area. And in this presentation, we'll talk about the educational opportunities, the research opportunities, my personal research interests, and current projects that I'm working on, and last but not least, the scope of our initiatives. All right, so first of all, I just want to introduce to you the circle, the scientific circle that I co-founded with Dr. Shmura. Now, Dr. Shmura is a neurosurgeon at the neurosurgery department, and he is probably the best mentor that you could ever ask for. So if you are interested, like me, in the neurological sciences, I really encourage you to join the circle now or later. We really take you from the beginning, you knowing absolutely nothing, not a word of how to, write a scientific paper, and we take you from, that beginner to a real scientist with real publications. And I'm not just saying that in the last, 2 years that we've been having this circle. We've published more than 10 papers last year, and even this year we've published several papers. So if you are interested, here's the circle. And even if you're not interested, we, well, in my very unbiased opinion, we are the best circle in the university because we really take the time and patience to help you. So even if you're not interested in the neurological sciences, I encourage you to join the circle. So I just want to give you an example of what kind of studies you could publish, and by giving you an example of what we have published. So you might have heard about the coronavirus pandemic, right? So on the day that the World Health Organization declared the coronavirus disease as big pandemic, we went on YouTube to see the quality of the medical information that was presented. And we literally watched hundreds of videos and used some validated scientific methods to objectively analyze them, and we found that the information was really poor, and we published here at a quite reputable journal, Reviews in Medical Virology, for the world to see. And actually a YouTube channel with I don't know, like about 1 million subscribers talked about our paper. So we actually made quite an impact, I would say. Here is one of my favorite papers that I had the opportunity to co-author. It's about spinal cord stimulation in failed back surgery syndrome patients, and if it leads to permanent occupational disability. So if you don't know, spinal cord stimulation is what you do if somebody has really bad back pain. You would do a surgery, like a back surgery, right? And if they still don't have pain relief after their back surgery, you can implant a spinal cord stimulator. And what this does is you just open up the spine, you put this little tiny implant in the spine, and it really takes away the pain. So we know that in science, that this implant can take away pain very well. But what we wanted to know was that even if you take away a person's pain, do they go back to work? Do they go back to work and contribute to society? And we found out, unfortunately, that that is not the case. Even if you take away a person's pain, they still, most of the time, don't go back to work. And this is a big problem because, right, I mean, you can take away a person's pain, but this is a big economic problem. So I thought this paper was very interesting because we not only looked at the science, but we also looked at its applications in the real world. And, well, to give you a hint of what we kind of discovered or discussed was that in Poland, the time from saying, oh my gosh, I have so much pain, to actually getting the surgery is so long. It's about 1-2 years. So that is actually the big problem. It's more the public health system, the healthcare system, not probably the actual surgery. So this is why it's one of my favorite papers that I've co-authored. All right, so I just want to reiterate the benefits of doing research. Of course, you'll get to learn about how to do research, and it'll fulfill your curiosity as a scientist. But also it'll help you, you can put it on your CV, and it'll really help you after graduation because you'll be applying to many hospitals, and with research it really looks good and you can get into a good hospital. I've also made, I've personally made a 7-hour Skillshare course for students here at the university, so they can learn, even if they're a beginner, to teach them how to do research. And that, of course, if you join the circle, is available to you. And we really do give you guidance from the entire process, from getting some idea to actually publishing it. So we take your hand, we hold it, and we go step by step. So you never have to feel that anxiety of, oh my gosh, I really don't know what to do. All right. So this is just a screenshot of the course that I talked about, my Skillshare course. So if you want to go there, go ahead. And last but not least, we don't just talk about research, but we also talk about its applications. So, for example, if you want to make a medical device, you need to know the basics of research to validate your medical device and say to the scientific world that, hey, this medical device that I made is actually worth something, right? So our research will, having this knowledge, it'll help you also to come up with novel ideas for a medical device. We'll teach you how to validate it to see if it's actually profitable in the real world, and learn how to build it from just an idea you have in your head to actually putting it as something you can sell, something you can hold and show people. And so we really look at not just, medicine, we look at the applications of medicine, about business, the business model canvas and design thinking about how to really design your idea. We look at the legal aspects of patents and how to go about that, because there's a lot you need to know. So we not only look at the medicine, we look at the law, and we look at, engineering and business. So yeah, I think we're quite different, because really no other medical school that I know about looks at these many different aspects, because you just don't have time. But in our circle, in our university, we look at that and really try to make you into more well-rounded scientist and human and person. All right, so thank you for your attention. Thank you very much. And if you are interested in joining the circle and coming into our university, I encourage you to go to this Discord link. If you don't know, Discord is just a place where people can hang out online, and this is a particular invite link for the Discord for our circle. I'm there, Dr. Shimura is there, and the other students that are in the scientific circle in our university are there, so you can message us, talk to us if you have any questions or if you want to join. So thank you, and I hope you have a great day.
Hi everyone, we're here today with Tala Glenstead, and we will talk about his experience with the Medical University of Gdańsk. Thank you for joining us today. My first question for you is, why the Medical University of Gdańsk? What made you choose our university to proceed with your career, and what made you choose the MEG to continue with your educational path? What made you think this is my way to go?
Well, for me, there were a couple of different reasons. One being that I had to redo some classes back in Norway, and we had worked, like this Norwegian school worked together with GUMED, so I was recommended this school, and I talked to some colleagues that were studying the classes over me, and they all recommended it as a nice city and a very professional university with good professors, and obviously it's close to for practical reasons, it's close to the airport, and for me going back and forth to Norway made Gdansk an easy, more of a practical city as well.
So it's research and proximity to home and professional staff. So tell me, what apart from being a student, I believe you're involved in research and various projects at the university. Could you tell us a bit more about what you do here? What fuels you, so to speak, as a young scientist, as an aspiring doctor?
Well, I think that the GUMED has a lot of scientific circles, which is beneficial for people that want to explore some specific parts of medicine. And I think the university is open for students to participate in both these classes and also other classes. And they are also very open if you want to join different departments at the hospital, you're able to send an email and you can join privately after school. So that's also very good. And also there's a lot of scientific circles conducted by other students studying 5th year or 6th year, which are good for younger students to help understand complex stuff like ECGs and just the basics. So I think the school has a lot of possibilities for people to explore the different departments.
So what grabbed your attention specifically? Are you participating in any of the scientific circles? Are you a part of a research society maybe? What are there any specific projects you conduct or participate in?
Well, unfortunately, I'm still third year, so there's a lot of studying, so that trumps the whole scientific circle thing. But I'm currently joining a ECG workshop conducted by some older students, which I find very beneficial for me coming into next year, fourth year, where we're supposed to be able to interpret ECG cases.
Okay, so there's a student community and there's the scientific community, and they are all coming together. Great, that's great to hear that you see the connection there. Now, are there any parts of the or any aspects of studying here that you particularly find interesting, apart from the scientific circles, about the student community? Is there anything you would like to emphasize to our candidates? What grabbed your particular attention here?
Well, I can say for people who wants to study here, I feel like first year with the practical classes in anatomy is probably one of the highlights so far, with the professors which are extremely professional and has a lot of knowledge, and you get the opportunity to work with live specimens. So to me, that was probably one of the most fun things I've done so far these 3 years, except from obviously third year where we are at the hospital and actually visiting patients.
So do you see yourself as more of an aspiring doctor or scientist? Because we are the way we work as an institution is that we combine these two sort of roles. We train professionals, physicians. However, we also are support scientific development for students. And do you see yourself now or in the future as more of a doctor, physician, or rather you see yourself as a scientist, so to speak, because the university offers?
I for sure see myself as yeah. Sorry, go on.
Yeah, that was that was my question. Sorry.
Yeah, there was a bit of lag, but I for sure see myself as a practitioner, doctor working with the patients. But I think that the school has evoked part of me that wants to do some research after a while. I don't know where in my career, but at some point I'll probably want to do some research as well.
So since our university is officially the only medical university in Poland that holds the status of research university, I believe there will be a vast spectrum of opportunities for you in the future. Now, if you could offer a piece of advice to a future candidate or who thinks about studying about the Medical University of Gdańsk and is still not sure about is this the right way to go, what would be your piece of advice for our future candidates, speaking from a three-year perspective, nonetheless?
Well, my first advice is to go for it. Just if you're thinking about becoming a doctor or pursuing that dream, I think you should for sure go for it. You'll never regret the day you started studying here, I think. Obviously, there will be some rougher periods when there's a lot of stress, but you will overcome it, hopefully. But I think that as an advice, I think if you come prepared to study a lot and also being able to take time off, Gdańsk is a super place because the city is not that big. So it becomes like a close, tight-knit society with the students. And also, I feel like it's obviously hard studying medicine, but it's for sure doable if you're dedicated. So, I mean, my advice is just to come prepared and come with a lot of motivation, and yeah, basically.
Okay, so I mean, what I find particularly interesting about what you just told me is that you see these different aspects of our university. You have medicine from a practical point of view, but you also have science. And I see from your perspective that these both paths, so to speak, appeal to you. So it's pretty good. It only proves that the university indeed offers a vast spectrum of possibilities for our future students, future practitioners. Now, is there anything you would like to add about your studying at the Medical University of Gdańsk? Is there anything you would like to emphasize to a larger audience?
Well, I think just the practical classes here are extremely good. All the professors are really good at what they do. So I feel like if you want to become a scientist, this is a good place. But also, if as a practitioner, I think you get a lot of practical knowledge, and also the way they teach, you become more prone to stress. I mean, to handle stress situations. I think after studying here, I will be at least prepared for taking decisions with high amount of pressure, and also making the right decision, obviously. And also that the hospital here, it's just finishing up, so it's brand new, and so all the equipment we have at our disposal, I think it's a huge advantage for us students.
So are you planning on staying here and practice medicine, or maybe are you planning on returning to Norway?
I think it's a bit too soon to say. My first goal is to pass everything, but I think I will probably seek a career in Norway. But it's too soon to say anything for certain at the moment.
Okay. Well, that's basically all we needed to know. And I would like to thank you for participating in this short interview. And will be a part of the Open Day 2021. And I would like to thank you all for participating, and have a good day. Thank you very much.
Thank you.
Bye.
Bye-bye.
Hi, thank you for joining us again. My name is Adam Tushinsky, and I work at the MUG's promotion unit. We're here today with Sławomir Wójcik, head of the admissions office. Thank you for joining us. And we will talk about admission rules for the English language programs at the Medical University of Gdańsk. This will be the second presentation covering all topics related to international admission. So thank you for joining us again. Now, let's say I would like to become an English division student of the Medical University of Gdańsk. What criteria must I meet?
The programs which we offer, they are programs for undergraduate students. That's why you have to be high school diploma holder. You have to finish the high school, depends on the system of education, it's either 12 or 13 classes. And your diploma must give you a permission to study medicine in the country where the diploma was issued. That's why if in your country, for example, you study in Scotland, there is required that you have a certain number of the subjects pass at the certain level. This diploma, this high school diploma, is also giving you permission here in Poland at our university to apply for the medical program. Of course, the internationally recognized diploma, like International Baccalaureate or European Baccalaureate, they're also giving you the same rights to apply for our programs.
Okay, now, since all programs are conducted fully in English, I believe I will need an English language certificate. Is that right?
Yes, the confirmation of the English language skills is really important. And what we are looking for the upper B2 level according to CFR standard. And there are many possibilities to confirm it. If you're a native speaker and your whole education was conducted in English, the information on the high school diploma is going to be completely satisfied for us. However, if this information is not written, but your education was in English, we are asking for additional document, and usually each school is able to submit such a document. If your education was conducted in language different than English, for the students from Scandinavia, Norway, and Denmark, the rule is that if your final grade from English was 4, it concerns Norway, C or VG in Sweden, or 7 in Denmark or higher, this is going to be treated equally to the level B2. Of course, if you are from a different country, you can show the international certificate confirming English language skills. There are some very popular, like IELTS from the level 6.5 and higher, or TOEFL. There are different variations of this TOEFL test. And also, right now, during the pandemic period, there are many opportunities to pass the international test confirming the English language skills. The whole list of the tests which are accepted by our university, you can find on our official website.
So these are, as I see them, unified criteria. So it's high school diploma, then you had 2 language certificates, and that's unified for each of the programs. Now, there are a few differences among specific programs, am I right?
That's correct. Very similar to the programs which are running in the Polish language, each program has its own specificity. That's why if you're applying for the Bachelor of Nursing, on your high school diploma, on your matriculation diploma, you have to have grades from biology and English language, and one of the subjects, either chemistry, physics, or mathematics. In addition, and this part is going to be revised by the admission committee. After that, you're going to be invited for the interview. The topics for the interview are given to the candidates. They can prepare themselves, and as a summary of this process, the final number of the points is given. Regarding 6-year MD program, the main condition is to have on the high school diploma grade from the biology at the advanced level, and one of the subjects, either mathematics, chemistry, or physics. Slightly different is if you're applying for the pharmacy. If you apply for the pharmacy on your high school diploma, you must have the chemistry at the advanced level and one of the subjects, either biology, mathematics, or physics. This advanced level equals HL, high level, if you compare it to the IB diploma, or A levels grades if you compare to the different system of the educations.
Thank you. Now, these were the criteria of admission. Now, there are specific admission steps one has to take to become the MUG student. Can we review them now, please?
Yes, of course. In general, the admission rules, it sounds really scary. However, it's a relatively easy process. Everything is conducted online. And we are going to start with the registration when you are using our online enrollment system. Then it's followed by the qualification. During this process, we are checking the electronic version of the documents which you have sent us. Then we have, depends on the program, either exam or the interview. The exam may consist the written and oral part. In a moment, I'm going to be more specific with this. Then it's the stage of the confirmation. We are going to confirm and we are going to ask for the paper version of the documents and for the payment of the payment for the orientation week fee. And finally, that's the admission for the studies.
Okay, now could we give each step a closer look, shall we?
Okay, let's try to start with the registration. The first step is to decide, okay, I'm interested in the study at this university, and I'm going to the website of the Medical University of Gdańsk, and on the website admission2021.mug.edu.pl, you have a possibility to register to our electronic database. Please pay extra attention on the obligatory fields. Please be aware that sometimes the confirmation link which is sent from our electronic database may go into your spam folder. That's why please check it carefully and then use the confirmation link, and then you have a full access to our electronic database. The next step, that's the step of the qualification. Once you are registered, you can submit the application form. There is a bunch of questions, usually the really easy ones related to the personal information, the information about the previous stages of your education, and the information about the knowledge of your English language, maybe Polish language, because the people who already are more fluent in Polish, they can choose for the first year a different language, different than Polish as a subject. And also at this level, we are going to, at this stage, we are going to ask you to fill the application form and print it. In the database, there is a very friendly button, printouts. At each stage, you can see different documents which are going to appear there. After you finish the application form and you are going to get a status submitted, you will be able to print 2 copies of your application form, one in English, one in Polish. The one in Polish, it's a direct translation of the English one, and it's an obligatory to have in the student files documents in Polish. That's why we're asking for this. Once you print it, please sign it and attach as a document, preferably in the PDF form, to your account. Also, please attach the high school diploma with the transcript of the grades. If it's in English, that's perfect. If it's in the language different than English, the translation of this document is necessary. For the verification of your data, we are also are going to ask you to attach the scan of your passport. Of course, all the data are confidential, and they are not going to reach any other place than the admission office. And then it starts our job. We are going to evaluate the grades from your high school diploma. You can also, prior to this, check on our website what is the calculation of the score. For the maximum grade from main subject, biology for MD program and chemistry from the pharmacy program, you can get 30 points, and for the second subject also 30 points. That's why the maximum grades from your high school diploma are giving you 60 points. Additional 60 points you can get from the entrance exam in the written form. The written form, it's a multiple choice test which we organize online. 30 questions is in biology, 30 questions is in chemistry. The samples of the questions from the previous years are also given on our website. The last step, that's the interview. During the interview, you may obtain up to 10 points. That's why in total, during the process of the admission for 6-year MD program and for the pharmacy program, you can obtain 130 points. In the previous years, 88 points gave you an entrance for the MD program, and 71 points gave you an entry for the pharmacy program. In case of Bachelor of Nursing, the procedure is slightly different because there is no written part of the entrance exam. As I said, we are going to evaluate your high school diploma, and for those 3 subjects, biology, equivalent of biology, English, and the third subject, you may obtain 50 points, 10 points, those are the points from the oral part from the interview, and out of those 60 points, 31 in the previous years were giving an access to study at the Bachelor of Nursing program. Finally, this unique non-graduate program, pre-med, 2 subjects are taken into the consideration, biology and one of the subjects from the list, mathematics, math, physics and chemistry, 100 points per each, 200 points in total. Usually 120 points gave you an access to the pre-med.
Okay, so let's say I submitted all the documents and my application, online application is successful and I'm admitted to the studies at the Medical University of Gdańsk. So do I have to send the physical copies of the documents to the admissions office address, which is Medical University of Gdańsk, alias Zwycięstwa 4142 in Poland?
Definitely yes, because finally we have to end up with the students' files in the physical paper version. That's why once you obtain the status conditionally accepted, it means you fulfill all the criteria, your high school diploma, the results of the exam are promising, good enough to let you start the study. At this point, we are going to ask you to send on the mentioned before by your address all the paper version of the documents. And also we would ask you to send you the fee for the orientation week, which for all the programs is 3,000 zlotys. Polish zlotys, and once we receive the document, once we receive the payment, you're going to get directly from the database an information that your status is accepted, payment received, and it means we are waiting for you during the orientation week.
In Gdańsk, and you are the student of the Medical University of Gdańsk. Dear listeners, thank you for joining us. This concludes the second and final interview on all matters regarding foreign admission. Thank you for joining us and see you in Gdańsk.
Thank you very much for being with us. Of course, I assume you have much more questions. That's why please visit our website www.admission.mug.edu.pl. And also, we are waiting for you. We can contact through our admission database, through the emails. You can also give us a call. I hope that all your questions will be solved as quickly as we can.
And enjoy the rest of the Open Day 2021. Thank you.
Education Week is a time especially for the first-year students to learn everything about our university, about the campus, and about all the things that are going around in here.
The infrastructure, the facilities, the staff and the students, it seemed like a really great combination of things. So we chose this university, and I think in the past few days that we've been around, we're really happy with that choice.
Yeah, I think it was a great pick because everybody here is so nice, the college is beautiful.
The reason I chose Gdańsk is because I had a really positive experience with the MUG staff of the test we had to take to get in, and also Gdańsk was the best option for me. It's also a great town to live in with very beautiful sea, and it's a very good choice for me.
Opening day has been quite exciting. We've met a lot of people from a lot of diverse places.
Yeah, and we're excited. Yeah. And the welcome was really warm with the free apples.
Yeah, sweet apples, they're really good.
And as you know, apple a day.
First of all, welcome everybody to the Orientation Week 2019. Okay, we will have a lot of things to discuss during this week. We'll have a chance to get to know each other.
The most important persons are you, actually, today morning. Thank you for coming. Welcome to our university, one of the best universities in general in Poland. And in some rankings we came first also among medical universities in Poland.
The Medical University of Gdańsk
is a modern academic center
with high scientific and development potential.
It is the best medical university in Poland,
with experience in renal research teams.
It is the only medical university in Poland
officially holding a title of the research university.
It has modern laboratories at its disposal,
along with a professional teaching staff.
Conducts a wide variety of study programs,
which ensures great development opportunities.
The university focuses on practical teaching of the profession by the means of a modern educational infrastructure,
3D printing technologies and simulation laboratories,
and a dental laboratory as well. Successfully applies for external funds.
Is the founding body for 4 healthcare entities in which innovative methods of treatment are being conducted.
The MEG hospital is one of the most modern medical centers in Europe.
The MUG has 75 years of rich history.
Unique units on a national scale.
Neurovascular and Stroke Center.
Translational Medicine Center.
International Research Agenda.
Phase 1 Clinical Trials Unit.
The Medical University of Gdańsk is science.
And science is people.
I think our biggest advantage are our teachers. Our teachers are highly skilled, both in a teaching and also as a scientist. So I think this is the first reason. The second reason are our laboratories, which are very modern, and also some of them has the same equipment like students may use later working in the industry, in the pharmaceutical industry. And the third reason, I think, is the general environment at our faculty. We are trying to be as friendly as it's possible. So yeah, I think those are the three reasons how to study the pharmacy at Medical University of Gdańsk. I think it's similar. What is very similar are the teachers, or in general our community, because like I said, we have very highly skilled teachers who also are great scientists. So it's a quite unique opportunity for the students to cooperate with someone who is a great scientist. So if someone is interested in science, it's quite easy to find somebody who will teach how to do the science. Okay, so to be honest, our Master of Pharmacy is quite a young study, so we don't have it settled yet, but our teachers and our students are very open-minded. So if you come to us with your great idea, for sure you will find somebody who will guide you what to do to make this idea real. In Gdańsk in general, I think few things. Maybe the most important is that Gdańsk is quite a big city, but from the other hand, you cannot see as much noise, as much rush in the other big cities. So you can take the advantage of a lot of greenery around the university. There is a seaside very close to the Faculty of Pharmacy. So after the classes, you can go and rest at the beach. So yeah, I think the location of the city is a very big advantage of this. If you want to join us, please come to our university with an open mind, with your hobbies, with your passions, because we need people like this to join our community.
Hello, my name is Puriya Hesami. I'm third year pharmacy student, English division of the Medical University of Gdańsk. Difference between Master of Pharmacy and Doctor of Pharmacy is the Master of Pharmacy have more researchable wide range, and they have most focus on the practical part. And you can help you in future to manufacture drugs or maybe discover new drugs, who knows. And if you want to learn a bit and you can ask your professors and your teachers, and they will be help you. First of all, I have to tell you about the very special online library which is filled with the most useful resources, and that you can find it, in my opinion, it's in the good region with good weather. And of course, the most important part of this university is their professors and their teachers, because they motivated me during these whole 3 years that I'm studying here. I want to tell you about my first year. At first year, at the end, my botany teacher, professor, gives me a book, a very precious book, as a present to me, and she signed it for me, as you can see here, and she signed it for me, and this book helped me to continue and don't stop, don't give up, which it motivated me a lot. And this book now is so helpful for me in third year for studying pharmacognosy, and it's very good source for me. The weather is one of the most important things. I like the weather, and the most important thing is the people. The very kind and hospitality behavior which they had with me and the foreigner students in here, and it's really good for me. If you love or like to find a new thing or find to discover, maybe if you love to working in a lab, the pharmacy is the best way that you can choose as your career, because the pharmacy, master of pharmacy focus on the working in the lab, and it's very interesting, believe me. And the most thing that you can do for your future, if you want to choose study pharmacy, is you can put everything near together. You have to study, and you can have fun and work out, or you can have a workout or have some fun things with your friends. Even all of this, you can do this together, and for sure you have to listen to your teachers and professors' advices. And one thing I have to say about the Gdańsk, I forget it, for students like me who love the plants and the pharmacognosy or botanical things, is in Gdańsk we have a lot of diverse species of the plants, which is really, really helpful for an interested person, student like me, which can help to study better and boost the knowledge.
Mimo ciągłego postępu medycyny przegrywamy walkę z schorzeniami cywilizacyjnymi, z nowotworami, ze schorzeniami kardiowaskularnymi czy też układu oddechowego. Jednym z problemów jest to, że metody diagnostyczne, które są wykorzystywane, te proste, oparte na krwi, są często niewiarygodne. Procedury, które są uznawane za bardzo pewne, takie jak endoskopia, są inwazyjne i zlecane bardzo często zbyt późno.
Takim przełomem dla badań, które prowadzimy w naszym laboratorium, było odkrycie krótkich sekwencji RNA w komórkach naszego organizmu, które odpowiadają za procesy regulowania wielu syntez białek przebiegających w naszym organizmie, i dzięki temu możemy w przyszłości myśleć o opracowaniu nowych testów diagnostycznych pozwalających wykryć już choroby na bardzo wczesnym etapie ich występowania lub jeszcze bardziej możemy myśleć o opracowaniu nowych leków do leczenia bardzo spersonalizowanych chorób i ukierunkowanych dla danej konkretnej osoby.
Każdego z nas charakteryzuje własny, indywidualny profil mikroRNA, którego zmiany mogą świadczyć o toczących się procesach chorobowych. Rozpoznanie takich sygnatur umożliwia wczesną, często poprzedzającą wystąpienie objawów takich schorzeń diagnostykę, a to z kolei wiąże się z wdrożeniem szybkiej, odpowiedniej terapii i przedłużeniem życia pacjentów. Takie odciski palców mikroRNA stanowią doskonałe narzędzie przy poszukiwaniu nowych biomarkerów, a także przy opracowywaniu nowoczesnych terapii spersonalizowanych, które są obarczone niezwykle niskim ryzykiem wystąpienia działań niepożądanych. Dodatkowo detekcja mikroRNA jest możliwa nie tylko w tkankach, ale także w płynach ustrojowych pacjentów, takich jak krew czy ślina.
U ludzi zidentyfikowano do tej pory ponad 2000 różnych mikroRNA, jednak jest to niewielka frakcja ludzkiego RNA, zaledwie 0,01%. Dlatego zebranie tzw. odcisków palców mikroRNA i oznaczenie ich konsekwencji w kontekście molekularnych mechanizmów schorzeń wydaje się ogromnym wyzwaniem badawczym.
Badania naszego zespołu koncentrują się na detekcji i określeniu oznaczenia biologicznego zmian sygnatur mikroRNA związanego ze schorzeniami cywilizacyjnymi, takimi jak choroby nowotworowe czy choroby sercowo-naczyniowe. Celem badań naszych jest bowiem uzyskanie kontroli nad mikroRNA przy pomocy syntetycznych analogów tych cząsteczek i przywrócenie właściwego poziomu białek w komórkach ludzkich, które mogą stanowić patogenezę tego typu schorzeń. Od 2018 roku, kiedy wprowadzono nowy lek Onpatro, który bazuje na takim mechanizmie, wpłynęło na poszerzenie tego typu badań na całym świecie, co przyczyniło się do wzrostu tego typu badań i opracowywania nowych terapii celowanych na rzadkie, nieuleczalne schorzenia, co może stanowić przyszłość współczesnej farmacji.
Hi, thank you for joining us. My name is Adam Tuszyński and I work at the university's promotion unit. Today we will be talking about mobility and international alumni scattered all over the world. I would like to warmly welcome the representatives of our university's Department of Internationalization. Karolina Derda from the International Relations Unit and Jacek Kaczmarek, the International Alumni Relations Officer. Now, due to the pandemic crisis, many countries were forced to impose global travel restrictions. Interestingly, however, the Erasmus program and the MUG stand strong and better than ever. Once again, we have been awarded the Erasmus Charter for higher education for the coming years. Karolina, could you tell us what this actually means for our university and our international mobility scheme?
Yes, that's true. We've got this Erasmus Charter for the future years. It will be active for our Erasmus program till 2027. That is very good information for us because there was some fear that it will not last. But we are very glad that it's very active and even the budget of the program is tripled. So it's very good news for all our students who want to spend their mobility abroad. And as you mentioned, pandemic, that is true that it affected our mobility because the situation was very bad. But some mobilities were cancelled and students were afraid of going abroad, and some flights even were stopped. But this year we can observe really huge interest in our students, and this year during our interviews and application for the student mobility for studies, applied over 100 students, which this amount is quite good for our university, and we are very glad that instead of this situation, students are not afraid, but in the other way they are very interested in traveling. They missed traveling because they stuck in this their countries, and it's a very good optimistic situation for us, and we try to be optimistic in this area. And also all traineeships were cancelled last year, but this year there is huge interest, and we really are glad that students still want to go abroad. And our students are vaccinated, so maybe that helped to be so brave and go abroad, and we are very satisfied with the interest.
Wow, thank you. Now, what are the most frequently chosen travel destinations? Is it difficult for the students to pursue a study program at a foreign university?
For many years, the most popular destination are still Italy and Spain. And students don't even lie and tell us that the sun and the weather is the main reason that they are going there. And what is very interesting that most of them don't even know the language of partners university, but they manage, and they complete their studies without any problems. And our students go for Erasmus studies to our university partners, and the program of the study is compared before we signed such a bilateral agreement. So there is any fear that they will go and they will have any problems to complete their studies. So we help them as much as we can, and also this year was, it's funny to say, but it was easier because they could this year mixed programs in our university and in partner university, because most of the lectures and most of the classes were taught online, so they could be in both universities. They could attend the classes. So it's a funny situation, but it was much easier for them, and they could pass every exam on time.
Thank you. Now, could you tell us how many foreign international students visit our university? What are their home countries? How do they find living in Poland and studying at the MUG? Is it a pleasant experience for them, as they recall?
I'm very proud that we are a very popular destination. And of course, what is funny, because for Italian students and for Spanish students, we are very popular. And there is no such a weather in the Gdańsk country, but still, maybe there is some other reason, but we are a very popular destination. Our university has very good opinion abroad, and our former Erasmus students, I think they are the best ambassadors of our university, and this good voice of the students is the best marketing for us. And as I said, it's still Italian students and Spanish students. Maybe it's easier for them because usually they come here in some small groups, for example 10 or 5 students, so they feel quite brave and more confident than maybe other students which, for example, come singles. But we have Erasmus Buddy program, so none of students won't left alone here, and we won't leave anyone to feel lonely. We help them. At the beginning of their stay, there is always some kind of integration party, or this year it was a spy game, which was online. And we can help everyone. We try to make any, some, except of parties, we try to organize some games and some other, activities to help them integrate and don't feel alone.
Thank you. Thank you so much, Kakuna, for your answers. Currently, there are about 1,000 international students from 65 countries with different cultures and religions pursuing their studies and future career at the Medical University of Gdańsk. Once they successfully graduate, they will become our alumni, our international ambassadors. Maintaining good alumni relations is essential to every university. Jacek, could you please tell us a bit about the process here, about the international alumni policy at the MUG? How are such relations established? How do we keep them strong and healthy?
Thank you very much, Adam, for this opportunity to say a few words about what I'm doing in the field of international alumni relations. First of all, we are pretty new to international alumni relations, so we have about 2-year experience in that matter in an institutional form. Secondly, it's important to keep in mind that our international alumni population is non-homogeneous. We have an unknown number of alumni from the Polish divisions who studied some time earlier, and they are scattered around the globe. Some of them have become very well-known professors, very prominent figures in medicine. Some others, thousands probably, doctors in different fields, pharmacists and dentists and others, scattered from Peru, Zambia and other countries. I am very pleased to be approached spontaneously by alumni from 60s, 70s and 80s who contact me. Of course, this is the benefit of the internet era. They look up the university website and they find out that there is a guy who deals with international alumni relations. So you asked about the policy. I would say that the policy is being created. We have a certain vision. We know what we want to do to achieve the goal, but we have to formalize the policy in a more concise document. But speaking of what we do, it's important that students see our alumni as successful, as satisfied with studies here and the job they have wherever they go. It's important for our alumni to be part of the academic community. So we organize webinars, we organize mentoring sessions where the alumni have a chance to share their knowledge, experience in different fields, and also give a positive message to those who decided to study at our university. We would like to ask our alumni for advice. We organized the first ever alumni satisfaction survey. But this happened within a project, hand in hand into the future. So basically including alumni, making them part of the university, and having them as partners in research and teaching. That's what we want to do.
Okay, thank you. Could you tell us a bit more about the project?
The project was implemented under the International Alumni Program of the NAWA, Polish National Agency for Academic Exchange. And the participating universities could actually create their own projects using certain blocks, certain elements included in the general rules and regulations. So we created a project in which there were several actions implemented, and I would like to mention 3 of them as the most important. First of all is the inclusion of our alumni in the teaching process through webinars and mentoring sessions. Second was the mentioned alumni satisfaction survey. It was the first survey of such type at our university. We asked questions about their satisfaction with the studies here, with life in Gdańsk, with the interpersonal experience. There were many questions covering a wide variety of areas. So that's number 2. And number 3 was the concluding conference, which we organized with participation of renowned experts from other countries who have decades of experience in international alumni relations. We benefited a lot from this. Also, we managed to send a delegation from the university for meetings at Polish embassy in Stockholm, and we met our alumni who graduated in the 60s, 70s, and also the recent alumni from English division. It's important to mention that first alumni from the English division only left the university in 2008. So year after year we get about 100 or so international alumni leaving the university. Majority of them from Scandinavian countries, Sweden and Norway. Many of them from India, many of them from other countries, Germany, USA, Canada, and also countries of Middle East, Arabic countries. We have a variety of alumni, many of them gladly and spontaneously engage in contact, sometimes more than that. And I hope that we can successfully continue what we started within the last 2 years. It's my hope, and I think we are all in this, that our alumni will have many reasons to be proud of our achievements, of their home university growth and progress, just as we are of their successes.
Thank you. We will keep our fingers crossed for the success of the project. This concludes our discussion. Thank you for your attention. Thank you for your time. Enjoy the rest of the open day at the Medical University of Gdańsk, and see you soon.
Hello, my name is Marzena and I'm a Welcome Point Officer at the Medical University of Gdańsk. Today we're sitting in the Welcome Point in my office together with Shada, who is a student of our university. She is the member of the resource team, a supportive organization to all the students of our university. She came here not the first time. We're meeting quite often to discuss the problems of our students and trying to solve that problems and think how we can help our students to feel comfortable at the university. The Welcome Point tries to be a very open and comfortable space for the students. It's one of the first places that students come into during their being here at our university. The first week here is orientation week. We are preparing as a Welcome Point, but also together with the students. And we want students to prepare how to live at our campus, how to get used to different situations here in Poland. Often the students are coming from very different countries, far away from Poland. They don't know the traditions, the law. So during the orientation week, we're trying to learn them how to live in Poland, how to understand our traditions, which sometimes are weird for the foreigners. So they can always come here and ask if they have any question. So this is the purpose of the orientation week. But we're helping and supporting the students not only during the orientation week. We're doing that all the time. So no matter what problems you have, you can come here to me and tell me what's bothering you. I will always do my best to help you. Of course, there is a lot of things that might be difficult for you when you come here. The legalization of stay, all the paperwork in Polish offices, which is quite difficult. But that's why I'm here. You can always bring the documents to me. I will help you fill in everything. I will also try to book you an appointment to the different offices. I will help you legalize your stay. But not only that, always if the student feels or just missing the family, you can come here, take a coffee, and we will just talk about everything what you find difficult here. And Shraddha also support the student in a way that you might need help while you study. And maybe Shraddha will say a few words about what is she doing.
Thank you. First of all, I would really like to thank you, the Welcome Point and people like Pani Marzena who are here to help us out 24/7 whenever we need help. About the resource team, which I am a part of. So we are a group of students from different years, and we try to help out the newcomers or even in general people, students who are finding problems adjusting to the new setting at the university. So we're like a small link between the student community and the authorities here. So it's like a smooth working between the two segments of Medical University of Gdańsk. We try our best, we as well, our students, but whatever we can do, we try our best to give them information regarding things as much as we can. And other than that, we try to hold academic events like mock exams. We have mock exams in anatomy before every colloquium. We try our best because we ourselves have exams. So we need to take out time, prepare questions for the students and help them out if they need any study techniques, or if in general, if they need any help with management with stress, or how to calculate different times of studying for particular subjects. We try to help them with that as well. And even other than academic, we have different fun social events. We have tie-ups with amazing organizations like IFMSA Poland, ANSA, SLF, and Phi Delta Epsilon, and we try to coordinate and cooperate to give the best of the experience of medical school as much as possible. Other than that, even if the students want to have a conversation about anything they want, we try our best to be there for them as much as possible. So at the starting of the first year, I had a student visa. After that, I had to apply for the permit all by myself. I faced some hardship because there was like a language problem. Most of the documents are in Polish, and that's one of the things which was very problematic. But for my second time, after that, the Welcome Point was up and about, and I contacted Pani Marzena, and she was really helpful, and she booked all of the appointments and helped me with the legal documents around the university which I need for the application. And I think it didn't take that much time. Within 3 months, I got my permit, and it was, I think, one of the most helpful and very smooth process with her when I cooperated with her. That was really nice.
We managed to work on a really great cooperation with our voivodeship, so we're able to organize the visits. I can take my students to the office. I'm assisting them when they are submitting the documents and the fingerprints. So I'm watching what's happening, I'm translating, I'm helping with the documents. So it's really very important that you don't feel lost, and you have this support during submitting those very important documents which are for the legalization of stay. But I would also say a few words about other stuff, because being in Poland, it's not only the documents, it's not only the paperwork. We as a welcome point, we're trying also to show you Poland, to show you our customs, traditions. So now, because of pandemics, we can do it only online, but hopefully pandemic will end soon. And then we will be able to go back to the practices we had before. So here at Welcome Point, we're trying to show you how Polish tradition look like. What do we do during different Polish holidays? We had a great Christmas Eve here. We were decorating the gingerbread, we were eating Polish traditional food. We had a lot of happy people here during that time. We were also organizing the event which was encouraging Polish students or people who are working at our university to take some English division student in during the Christmas time. So the student had a great opportunity to see how do we celebrate Christmas at homes, what do we eat, how do we spend that really special time for Polish people. We are basically very traditional. We like to feast at home, we like to eat a lot, and it was really nice for both sides, the Polish side and the foreigner side, to see how we really are at our homes, not only at the university. So I hope that when the pandemics will be over, we will be able also to come back to this great tradition of celebrating Polish holidays together with our English division students.
A couple of friends of mine took part in the event that Pani Marzena said, and it was, I wish I could have been a part of it, but I can recall that the families were very welcoming. There was a huge feast, and they were all happy and singing and having so much fun. It was like a different experience for my friends as well. And maybe this year, if the pandemic allows, like if everything is fine and the situation is okay, I would really like to take part in it, definitely.
Yeah, this type of experience help us to see that even we're not the same culture, we have a lot in common, because in different cultures we have different religion, different beliefs, but it appears that we still like the same stuff. So we like to gather, we like to spend time together with our families, we like to eat, to sing, and no matter from where you are, you can find something what reminds you of home, even here in Poland. So this is the purpose of Welcome Point, to show you that you're not alone, that there is always a place you can find help and understanding, and you just have to know where to go to find that help.
Nursing English Division is a faculty which is based on strict European and US standards, and it includes basic sciences like anatomy, physiology, pathology, basic and specialistic nursing like physical examination, research in nursing, internal and surgical nursing, pediatrics, anesthesiology and intensive care, and also social sciences like psychology or ethics in nursing. Secondly, more than half of hours which students spend on our university are practical classes. So they spend time with patients in the hospital in our modern and specialized university clinical center. And the third reason, teachers from Institute of Nursing and Midwifery are passionate and active clinicians, so the knowledge given to the students is very up to date. According to 2020 higher education rankings, Medical University of Gdańsk is #1 medical university in our country. MUG is also first medical research university in Poland. Our university is well recognized all over the world, and we've got international accreditations. Almost 20% of our students are international students. We have a lot of student scientist circles and students associations. You can try also your abilities in sports sections. We've got volleyball, football, basketball, swimming, aerobics, skiing, etc. When there will be no pandemic in the future, you can meet with other students in our club Medic. Gdańsk is one of the most beautiful cities in Europe, with an old town and beautiful sandy beaches. We call Gdańsk a city of freedom. Here the solidarity movement has started. We are a very open city. We've got international students not only on our university, but also on University of Technology and University of Gdańsk. Study hard, be watchful and dedicated. Remember that it's better to ask even 100 times than make a mistake. Medicine and nursing require knowledge, practice and humility. But remember also that studying is a very beautiful time in your young lives, so enjoy it in our beautiful city.
So my name is Veronica Franzen, and I'm a second-year nursing ED student. There are several reasons to why you should study nursing ED at MUG, one of them being that you get to study with a lot of international students, as well as our classes are small, meaning that you're able to get individualized follow-up by a lot of our teachers, as well as you're well prepared for the nursing or becoming a nurse due to a lot of practical hours that we have. MUG is unique as it binds people from all over the world, and it teaches you how to value the differences as well as work together with your fellow colleagues. There are several extracurricular activities at MUG, such as a variety of sports teams, there are scientific-based events, as well as, for example, the Student Council. The greatest advantage of studying in Gdańsk is that the city itself is very beautiful, as well as there's a lot of things to explore in the city. My advice to future students is to know what motivates you, as well as to know how to motivate yourself when you find some of the subjects challenging.
Hello and welcome to the Medical University of Gdańsk in Poland. Right now we are in the front of our main building. Today I'm going to invite you for a guided tour among the university, the largest and the most modern university of all medical universities in Poland. I'm going to tell you a little bit about our history and also show you the main buildings of our infrastructure. First of all, I would like to invite you to the rector's office, the main office of our authorities. Please come and enjoy with me. Remember, in those hard times, the most important thing is the mask. Let's put the mask on and hope we go. As you may see over here, the office of the main director. The old medical furniture from the old city of Gdańsk, and this is where rector has his official meetings. Maybe someday with you. Our university campus, oh, I may take it off now. We are outside, we do not have to wear the masks on yet. Maybe in about half a year, when you will see this movie, we'll be able to do it inside and everything will be normal. But coming back to way, our university campus is at the same area, but we are divided into a couple of buildings. Right now I will take you to our, let's say, first building, where your first steps as new students are going to be. In that building there is a recruitment center, admission office, also our main auditorium and classrooms. But the thing I want to show you today is the museum of the Medical University of Gdańsk. Let's go, come over. Ateneum Gdańskie Novum building. The first building of the Medical University of Gdańsk. This building was the one of the buildings, probably the only one, which lasted after the Second World War. It used to be the main building of the university, and also the center of anatomy department. Today, like I've told you, we have the auditorium, the classrooms, the offices, Dean's office of the Faculty of Medicine, the heart of it is over here, and also admission office. We will try to reach downstairs to the cellars of the university, of the building, where the museum is. Come on, let's go inside.
Hello, welcome to the Museum of the Medical University of Gdańsk. This is the place when we focused all our tradition and heritage, tradition of our university and tradition and history of the medicine and medical science. Here in our exhibition you can see all the things that are connected with development of the medicine and our university in the last 75 years, and that all the stuff, all the objects are somehow connected with the science, with the medicine. They are really fantastic. that all is in our Medical University Museum. I invite you to visit here on site or via internet. Bye bye and good luck.
And welcome back again. Did you have fun? It was great to see Marek Bukowski, the head of the museum of our university and the old times. Right now, I'm going to take you to our office, International Relations Office. Oh, by the way, I'm sorry, I was so nervous at the beginning, I didn't tell you who I am. I'm not a student. My name is Dawid Spychała. I'm the deputy head of the Department of Internationalization of MAC, and right now I'm going to take you to our office, our building, and to show you the welcome point where your second steps are going to be, but about that we will hear in about a minute. Let's go. I just wanted to tell you, by the way, we are talking about the university, but over here we've got the whole infrastructure of any social needs you need. Right here you've got the pharmacy, the bakery, even the clothes shop, or if you wish to have some coffee, our little cafeteria, Italian restaurant, and just by the corner you've got a deli shop. So everything in about a 1 minute distance, especially for you. Okay, this building, I've told you before that one of the first buildings was the Atheneum Gdańskie Novum building. Yes. It used to be the anatomy department, and also, which is a common thing at the medical universities, a center of prosectoria. But the main building of the university was this one. This is the building number 1. Actually, the number of this building is 1. This is the building of the old hospital. The first hospital used to be over here. And it was divided. Half of the building used to be a hospital and half of it classrooms. As you could see, there is still some construction because this building is very old villa. Now adapted into our offices, and also, as you see, a beautiful one, welcome point. At welcome point, one of our co-workers, Ms. Marzena Kołtoniak, is a person who will advise you and also help you during your time over here, not only for studies, but some legal issues, and social things. This is the International Relations section. The office commonly called Erasmus office. About the Erasmus program, you may read at our website, but I think you already know what it is. This is the Student Exchange Program. This is the center for patients. This is the clinical hospital of our university. Invasive medical center and non-invasive medical center, the most modern hospitals in northern Poland and also in the whole Poland. See? As you may see, I told you that the whole campus is all in one. Building number 13, where we were at about a minute ago, and over here the old part of the hospital and the new one. In those buildings you all will have clinical rotations, clinical practices, but also if anything happens to you, you will get in over here. Right now we will take you to the library, and I will show you the dormitories. I will show you here this institute, Collegium Biomedical Institute. This building is the largest building, the facility of classes. All classrooms for exercises, but also 3 huge auditoria are placed over here. Also, beneath the first floor, there are new prosectorias and anatomy department. Over here, we used to have our kindergarten, but right now, this is the Department of Foreign Linguistics, the Center of Languages, where you may learn also Polish, of course. Our new library, we are just hopping in. The main difference between the libraries, the city libraries, and other university libraries and medical university libraries, a lot of libraries over here. The main difference is that at this library you don't only read or rent books. Over here you also may rent a phantom, for example, of skull, of a human body part, and by the silent corner you may learn. We are going to come inside the Collegium Biomedicum building. I don't have to be quiet right now. I don't have to speak loud because I think that we are the only persons at this floor. During the academic year, normally there is a crowd of students over here chatting during the breaks among lessons, classes, learning here, studying here. This corridor is the main corridor of the whole life of students' life during the classes. Right here we've got the whole auditoriums. I will try to show you one of them, okay? We're going to show you Stanisław Hiller Auditorium, room number, room A. We have left the Collegium Biomedicum building. I will take you now to the last part of our university, but I think one of the most important for you. So, students' campus, I mean dormitories, and students' club. one of our faculties, because we have 4 faculties. The main faculty is the Faculty of Medicine, Faculty of Pharmacy, Faculty of Health Sciences, and intercollegiate Faculty of Biotechnology. But also on the Faculty of Medicine there is sub-faculty of dentistry, stomatology if you prefer. This is the building of stomatology, one of the buildings. Right now still there is dentistry going on, but in a couple of months the new building is going to be built for them. Right here, if you have any toothache, anything happens with your teeth, you're more than welcome to visit the Faculty of Dentistry and ask a doctor for a service and help. Okay, we are by the main gate of our dorms, of your dorms. Dormitories of the Medical University of Gdańsk are separated into 4 buildings. One of them is specially for you, for foreign students, but of course, if you prefer and you have a wish like this, you may live in a dorm with Polish students. This is the thing we try to do. We try to mix you guys, the foreign students, with our Polish students. But it's all up to you, of course. How do you choose? Right over there, you've got a students' club called Medic. Usually, during the academic year, there is a students' canteen, a restaurant, for you, for students, with special prices, open daily from 12 to 5 p.m. During the weekends, student organizations sometimes rent the club for special parties, discos, or a thing called Medicalia, which is the students' holiday, where the president of the city of Gdańsk gives the key to the city to students, and for the whole week the main authority of the city are you. Let's see if they let us into the room. Alright, we will enter one of the rooms, and as you may see, it's a beautiful green color of the one of the floors. All floors are in different colors. The first floor was chosen to be green because this is the color of hope. If you decide to live at the dorms, remember that the most important person in each dorm is its head. Right here we've got one of the heads of dorms, Mr. Marian Piątek. Okay. And this is a usual room of each student. Normally, students may choose if they wish to live in a room, in a double room or a single room. Of course, each situation, it depends on each situation. This also is an equipment of the room. At the start you have a fridge, microwave, sink, alright, and a bed or even 2 beds, if you are lucky. All the furniture is included. And that's all, folks. Thank you very much for watching. I hope that I didn't bore you too much, that you got some information which is going to be useful for you. And what may I say? I invite you to study, learn and live in Gdańsk. Thank you very much. Take care. Bye.